This government meeting is brought to you by Eastworks and our local cable subscribers.
I'll make a motion to start the Easthampton Board of Health meeting at 5:31 p.m. on June 10th.
I'll second that motion. All in favor, Beth, yes.
Steve, yes. And here's if you could read the disclaimer, that'd be great.
Okay. Yes, I'm here. In accordance with Mass General Law, we are required to let you know that this meeting is being recorded. We will begin the meeting with 15 minutes of public speak time, 3 minutes per speaker. Raise your hand if you would like to be recognized by the chair. Please note that during public speak, the board will be actively listening to your input for future discussion, but will not be responding to any comments at this time. Please do not speak unless recognized by the chair, and all comments should be addressed to the board. You can also submit a question or topic for later discussion via email to the health@easthamptonma.gov email.
Thank you very much. We'll start with item number 1, public speak time. Ryan, if you could manage that.
Oh, of course. So I'll call your name, 3 minutes. When you have 10 seconds left, I'll just let you know to please wrap up your thought. Before you start, please just state your name and your address. And we will start with Stephen Helfer.
I think I spoke before you before, so I will endeavor not to repeat myself. I also have sent you 2 emails. I did repeat myself. Sorry to fill up your inboxes. Also, I'd like to thank Ryan Griffin for very kindly responding to me and taking the time on an issue that evidently he and I disagree on. The only thing I will say is, in the article that appeared in the Globe today, there was a comment that I thought was very to the point. And when I mention what it said, I do so respectfully and don't mean to be flippant. But this writer, who evidently is a man in his 70s, said if that the state or these towns want healthy outcomes, maybe people born after the year 2006 should not be able to purchase marijuana, alcohol, engage in gambling, or eat ultra-processed food. If people think that future generations of adults are unable to make a good decision regarding tobacco and nicotine products, what makes you think that they will make good decisions regarding these other matters? My name is Stephen Helfer, and I'm calling from Cambridge, Massachusetts. Thank you.
Thank you, Mr. Helfer. Next, we have Commissioner O'Leary from Northampton.
Good evening, Chair, members of the board, and public that are attending tonight. As Ryan said, I'm Meredith O'Leary, and I serve as the Health Commissioner of the Northampton Department of Health and Human Services. I have more than 20 years of experience in public health, helping communities address complex health challenges through prevention, education, and policy. I appreciate the time you're allowing me to speak today about nicotine-free generation policy, and I appreciate your consideration on including this policy in your tobacco regulations. So Earlier this year, after nearly 2 years of public meetings in Northampton and community forums and stakeholder engagement and thoughtful deliberation, the Northampton Board of Health adopted the nicotine-free generation. Throughout the process, we heard from a wide range of perspectives from residents, retailers, public health professionals, youth, and advocates. While opinions varied, the public health objective remained clear. Preventing nicotine addiction before it begins is upstream good public health. Tobacco use remains the leading cause of preventable disease and death in the United States. I need to mention that. It contributes to cancer, heart disease, stroke, chronic respiratory illness, and numerous other health conditions that affect individuals, families, and communities. As smokers quit, become ill, or die from tobacco-related disease, tobacco and nicotine companies must continually recruit new customers. Internally, industry documents released through decades of litigation made this reality super clear. One R.J. Reynolds document stated that younger adult smokers are the only source of replacement smokers. Simply put, the industry's future depends on new generations becoming addicted. Over the decades, we've watched industry repeatedly reinvent itself to attract young people. We saw the Marlboro Man, we saw Joe Camel, we saw flavored tobacco products, and then the Juul epidemic, where the youth-friendly flavors and sleek designs fueled a dramatic rise in youth nicotine use. Today, we're seeing the rapid growth of oral nicotine pouches, products that are discreet, inexpensive, heavily marketed, available in appealing flavors, and often contain very high levels of nicotine. There's always going to be a next product. Public health often finds itself reacting while the nicotine industry develops new ways to recruit another generation of users. At some point, we must ask ourselves in public health whether continually responding to the new products is enough, or whether we should pursue strategies that address the underlying cycle of addiction. And that's where nicotine-free generation comes in. And remember, we're not punishing current users. This is, again, to stop the youth from becoming addicted to these harmful products. So I just feel that this is super important. It's got some really good traction here in Massachusetts. And like we've seen with other good public health strategies adopted in our policies, in our tobacco policies, it takes a number of communities where we have impact at the state level. We were one of the first in Massachusetts, in Northampton, with
10 seconds, Commissioner.
Who increased the minimum legal age to 21. So I'm proud of all the work that you've done. I'm proud of the work that you'll continue to do. Just this is really important, and I hope that we have a great discussion about it. If you have any questions, I'll remain online.
Thank you, Commissioner O'Leary. Next, we have Kalia.
Yeah, great. Thank you so much. Good evening, everyone, Chair, Board of Health members, and the public. And thank you so much for the opportunity to speak tonight. My name is Bhavika Kalia, and I'm a high school junior from Somerville, Massachusetts. I'm here to speak tonight in support of the nicotine-free generation policy on my own behalf, but more importantly, I'm here to share my perspective as a young person who is growing up in the middle of this issue. Over the past year, I've attended Board of Health meetings in Somerville and Chelsea, where they were also considering nicotine-free generation policies and had them passed. I also had the privilege to testify at the State House in support of the statewide bill. Those experiences were incredibly meaningful to me, but they also opened my eyes to something bigger. At many of these meetings, when I looked around the room, I noticed that there were very few young people there. Yet at the same time, the tobacco industry had professional lobbyists present, people whose job is to advocate for those companies that sell nicotine products. As a student sitting in those rooms, that felt like a powerful and honestly uncomfortable realization. The people whose lives will be shaped the most by these decisions, young people like me, are often the least represented in the conversation. Meanwhile, the industry that profits from addiction always seems to have a voice at the table. That experience is a big part of why I keep showing up to speak about this issue. I also wanted to share something a little bit more personal. My family are immigrants, and like many immigrant families here, they worked incredibly hard to build stability. At one point, they even owned a small convenience store in Somerville. So I want to be very clear that nothing I'm saying tonight is meant to demonize or target small retailers. I understand how much work and sacrifice goes into running a small business, especially for immigrant families who are just trying to make a living and support their communities. But when we talk about policies like the nicotine-free generation, the real issue isn't small retailers. The real issue is the industry behind these products. For decades, tobacco companies have intentionally targeted young people and communities of color through their marketing, flavored products, and the ways they place and promote these products. They have built enormous profits by creating addiction and by focusing on communities they believe will be most vulnerable to their marketing. Nicotine use and vaping has been incredibly common amongst young people and students. I've seen it myself with students vaping in bathrooms between classes, friends who tried it once because it seemed harmless, and now they're telling me that they wish they had never started, and peers who genuinely want to quit but feel like they can't because their bodies have become genuinely dependent on nicotine. And my generation deserves to have the chance to grow up in communities where addiction isn't normalized and where our health is prioritized. So I really hope that you will consider supporting the nicotine-free generation policy today, and will continue Massachusetts' leadership in protecting young people. Thank you so much for your time and for listening.
Thank you very much. Next, we have Anna.
Hi. So my name is Anna Pereira, and I'm from Everett, Massachusetts. I attend Everett High School. And thank you for allowing me to speak tonight in support of nicotine-free generation policy, also known as NFG. When people hear the words tobacco prevention, they think about cigarettes, but my generation is facing something different. We're facing an industry that has adapted and rebranded. It has redesigned addiction to appeal to young people. Today, nicotine comes in bright colors, sweet flavors, and more modern devices, and just like discreet pouches like Zins that can be hidden in a pocket, a backpack, or even like a sleeve, the sleeve of your hoodie. These products are marketed as cleaner, safer, and more modern, but the only thing that hasn't changed is that nicotine is addictive. And I know this issue, it's personal to me because tobacco has affected my family for as long as I can remember. Both of my parents have smoked for more than 2 decades, and growing up, I watched them struggle to quit, trying over and over again, only just to find themselves pulled back by addiction. And nicotine doesn't just impact one person, it impacts entire families. The NFG policy, it's not about punishing adults, taking away people's choices, like free will. Adults are legally able to purchase tobacco products today and would still be able to do so. This policy just prevents future generations from becoming customers of an industry that profits from addiction. The tobacco industry needs young people to replace the customers that they lose every single year. They need new users because addiction is their business model. The NFG policy tries to break that cycle, and researchers show that most people who become addicted to nicotine before the age of 21, and that when the younger someone starts, the harder it is to quit. And just by preventing their access before addiction begins, we can save lives, reduce like healthcare costs, and just create healthier communities. Like, we see the marketing, we see the products, we see our classmates struggling in class before they're old enough to vote. Like, we're talking about 15, 14, 16-year-olds. Like, these are kids. We're the generation that will live with the consequences of the decisions that are made today. So I ask that you not only like think about the next year, but start thinking about the next 20 years. Think about students sitting in your schools today, the Easthampton High School. Think about children who haven't even entered kindergarten yet. My school, it's a K-8 school, so it's literally first graders in classes in bathrooms with 8th graders, seeing 8th graders smoke in the bathrooms. Think about families that may never have to have the experience of losses that mine have. And just tonight, you have the opportunity to stand for health rather than addiction. So I respectfully urge you to support the NFG policy. Thank you for your time and for your consideration.
Thank you very much. Next, we have Maureen.
Hi, everyone. My name is Maureen Busby. I live in Melrose, Massachusetts. In my daytime job, I'm a tobacco prevention program manager. I work in communities around my area, Malden, Melrose, Wakefield, Winchester, Stoneham, Reading. Those communities were the first boards of health in the world to adopt this policy. So we've had, other than Brookline that adopted it as a bylaw in 2020, my communities adopted it by Board of Health regulation. So right now we have the most experience. And in addition to the letter that I submitted to the board a few days ago, outlining why I'm in favor of this policy, I just want to say, in addition to that, I've had the opportunity to speak with retailers for the past year and a half since this became effective in this region. And basically, we've had no issues, no problems. In fact, many clerks, managers have said to me, it's so much easier now. All we do is look at the year of the birth. They don't have to calculate every day like you do right now, where in communities where it's still T21. They just know if somebody was in my communities, it's 2004 is the cutoff date. So they just look, somebody was born before 2004, they were 21 on the effective date, they're eligible to continue to buy. If they were born in or after 2004, they can no longer buy. And that reduces youth access to these products because we know that youth still get most of their products from their social circle. The bigger we make the gap between an 18-year-old in high school and someone who can legally buy, the more opportunity we have to reduce that access to these poisonous products. Nicotine is a poison. And if we were to try, if it wasn't legal already and we were to try to make it legal, it would not pass any regulation, any regulatory body, federal or state, as a product that should be legally sold to anybody, much less used by our kids. Thanks very much.
Thank you, Maureen. And lastly, we have Heather.
Hi, everybody. I've spoken to you before, so I'll try not to repeat everything. But I will just say I agree with all of the comments that have been made currently. And I wanted to just add, so I'm Heather Warner. I work at the Collaborative for Educational Services as the Hampshire Franklin Tobacco Free Community Partnership Coordinator. Easthampton is one of my communities through the work that I'm doing. And I have spent many, many years working in depth in Easthampton. One of the things that we do is we survey young people in the Easthampton middle school and high school. And one of the things that we've found is that, as Meredith was saying, it's kind of like whack-a-mole. When we get one tobacco product under control, like the smoking rates go way down, vaping is introduced. And all of a sudden we have an epidemic on our hand. Once we eliminate flavors from vaping, up comes these pouches. And so I was actually shocked in our 2025 data to see that pouch use in 12th grade has risen to 9% of regular users, meaning past 30-day use. And, while cigarette use is also at about 9% and vaping is still at about 25% among seniors. And I have the 8th grade and 10th grade data as well. I would also just like to say that, to the point about, taking people's freedoms away, people's freedom is taken away often at the age of 16 or 18 when they start smoking, and when they are heavily marketed to online, on social media, and when there's incentives even to, use these products through prizes or other things that you get from these companies. And so I think the freedom right there, it has been taken away. And like some of the young people said, most people start when they're below the current age to smoke. And I think, like Ken has said in the past too, when you begin to increase that gap, because we know that young people are accessing this somehow. And so if they're accessing it from older people who are purchasing it, locally, if we increase that age, and at some point you might have a 26-year-old who, is the age to purchase that. And they're not going to be necessarily sharing with an 18 or a 16-year-old in the same way that a 21-year-old might. So I think, for so many reasons, this is an amazing and powerful way to go up and against an industry that is pretty relentless in its targeting and marketing of LGBT, BIPOC, and young people. So thank you for considering it.
Thank you very much, Heather. And that is everybody for Public Speak.
All right. Thank you so much, everyone, for joining us, for taking the time to share your thoughts. We really appreciate it. And I think we can move on to agenda item 2. Approve the meeting minutes from May 13th. So I reviewed them and I had no issues other than which I shared this with Irza, but my Google name is Beth Mikris, but my legal name is Beth Riss. So I apologize for the confusion there, but we'll make sure that's accurate going forward. Steve, you good?
Yeah, I didn't have anything to add, so I will make a motion to approve the meeting minutes from May 13th, 2026.
I'll second that motion. All in favor, Beth, yes?
Steve, yes. All
right. The next agenda item is we have a presentation from Easthampton High School, We the People students regarding the NFG proposed policy.
Hi, everyone. Thank you for having us. My name is Kelly Brown. I teach the We the People course at Easthampton High School, and there are 2 students joining us tonight. There's supposed to be a third, but she is stuck at work and can't get a ride home, so she's trying very hard to join. And the students are kind of trying to figure out her notes a little bit on that. But I thought I might provide a little bit of context. I was hoping, would it be okay if I shared a presentation that we put together, a Google presentation?
Of course.
Okay. So I'm going to go ahead and share my screen. The slideshow, hopefully. Okay. So you all can see that okay?
Yes.
Okay, great. So just to provide a little bit of context, and I think Oliver and Aiden, if you want to unmute and maybe introduce yourselves, and then I can provide a little bit of context, and then they're going to talk about the substance of their kind of weighing the pros and cons of this type of a bylaw or ordinance.
Yeah, you go ahead, Aiden. Hi, my name is Aiden Favorite. I am now Easthampton High School graduate, and I took We the People in my junior year, and I mentored this last year.
Hey, I'm Oliver Oporowski. I'm of the same qualifications as Aiden, and I appreciate you having us tonight.
Yeah, and our third student, Iona Cooper Bias, is trying to join, like I said, so she may pop in at some point, hopefully, to share her thoughts as well. But I wanted to just set a little bit of context. The way that we actually looked at this was by actually looking at the Massachusetts Supreme Judicial Court case, the Six Brothers v. Town of Brookline. And so we actually sat and really went through that case to familiarize ourselves with what these bylaws were really about and kind of the legal and constitutional status of them. So I think what I'll do is very quickly just go through a couple of these slides that we put together from the case, but also just make this available to you. You may be very familiar with the case. You may not be. It may not be part of your consideration, but I think it was something that was really good for us to kind of understand the legal status of these bylaws and rules. And so I will make this available to anybody that would like to see it afterwards. So really this case centers around the Massachusetts state law and then the bylaw that was passed in Brookline. As you all know, in 2018, Massachusetts passed a law establishing age 21 as the cutoff for being able to buy tobacco products. And then a year later, actually, they amended the food and drug law, the federal food and drug law, to do the same thing. And so 21 became the age to purchase tobacco. And then in 2020, of course, Brookline was the first to pass one of these tobacco-free generation laws or bylaws, which established these two groups. Group one being the folks that would not be impacted by this law, and then group two being the people born after 2000. And obviously that is establishing kind of those who were 20 years old and younger, and saying that they would never be able to buy that. And then the case is essentially that you have business owners that sue, saying that this law actually preempts the state law, and therefore, or that the state law actually preempts the bylaw, meaning that it comes in conflict with, and of course, in our federal system, you know, Constitution, federal law, state law, and then what local ordinances and local governments are allowed to do under state law. So they're arguing that it was preempted by the state law, but they also argue that there was a violation of fundamental rights and potentially equal protection in violating people's liberties in dealing with the purchase of tobacco. The law itself dealt directly with preemption. And so that was something that we talked about. We talk a lot about preemption and We the People and understanding how preemption works. And this law actually set boundaries for what would actually preempt or not preempt. And it was pretty clear that essentially, if it didn't fit into one of these three categories, that that cities had the authority to limit and even fully prohibit the purchase of tobacco. So that was one thing that was interesting for us to look at, is the city could wholly prohibit the sale of tobacco in it without necessarily being preempted by state or federal law at this point. Unlike the federal government, state governments have massive police powers to regulate health and safety in all sorts of ways, except that are limited by their own constitutions and their own laws. And so the idea that they can regulate public health and safety and put limitations on these things is much broader than something like a federal law, which has to find these enumerated powers like commerce and other things to actually identify a place where Congress would find that power. States have very broad power to do so, and local communities can't pass things that come in direct conflict with it. So for example, they couldn't pass a law that says people who are 20 years old have to purchase tobacco or have to be able to purchase tobacco. But the way that we look at it is that the law is a floor and not a ceiling. So if cities want to go further and they're not prohibited of doing so by the state, then they can actually go forward more to limit for the purpose of the public safety, and they just have to be in alignment with rights that are established under the Constitution. They looked a little further into whether there was an implied preemption. So one of the things that could happen is that an ordinance could actually frustrate the purpose of the law. That's kind of how they looked at it. And so in this particular case, they looked at what's the purpose of this law. And it says very clearly in the law that it was to protect youth from the health risks of tobacco and nicotine addiction. Therefore, with this ordinance in place, it's actually furthering the purpose of the law, not frustrating it. And one of the things that they clarified is the purpose of the law was not to preserve a right for people to purchase tobacco. The purpose of the law was to protect youth from addiction. And so that becomes really important when they're looking at like the legality or the constitutionality of these bylaws. Another argument they made had to do with equal protection and whether there was a violation of equal protection because you're targeting a particular group. Aiden, did you want to say anything about this slide in particular?
I was just gonna say, like, kind of just the basics of it. So essentially, the argument for the equal protection argument is that by shutting off the ability to purchase tobacco to a certain age group, you're discriminating against that age group and therefore violating the equal protections program. Equal protections, anyways. But essentially that doesn't stand up because unlike race, age only holds up to rational basis, which means that in order to discriminate against someone for age, you would need to have all you need is rational basis. So the argument that I would always like to use, like the example I always like to use is that you don't need like to go through some big court cases to say that a 2-year-old is not allowed to drive a car, right? You can say logically, this person should not be driving a car. So people under this age are not allowed to do so, right? And so that's kind of the whole. So in this situation, you could just say that because these people are of a certain age, they shouldn't be able to buy tobacco, and there's really no way that to legally get you for that, essentially.
Yeah, and these levels of scrutiny are something that come from the federal constitution, but almost every state has adopted the same thing. So it's essentially, suspect classes have to face a much higher level of scrutiny. If you're going to pass a law that discriminates based on race or national origin or religion, you have to really have basically a compelling state interest, and it has to be least restrictive. But when it comes to age, there's all kinds of reasons we discriminate based on age. And so all you need is a rational reason to do so. And so when the litigants argued essentially that they should have a higher level of scrutiny, the court came back and said, no, that this is something that is pretty simple and pretty standard for constitutional law at both the federal and the state level. And so essentially what we determined, and this is what we do in We the People, and it's a lot of fun, is just to sort of sort through these cases. But what the case determined is that this Brookline bylaw doesn't come in conflict with state law. It doesn't violate the Massachusetts or the federal constitution. And they looked at the issues of preemption, equal protection, and whether there was some sort of fundamental right to access tobacco. And they said in none of those cases do these things actually apply, that this falls very clearly under the police powers of the state and local communities to do so, acknowledging that they could completely ban tobacco if they wanted to. And so now really for the, I'm not sure everybody wanted that legal lesson, but we were happy to come and share it. But now the students really went through and created kind of what they thought were some of the pros and cons of looking at adopting a bylaw or an ordinance like this that creates this tobacco-free generation. And we wanted to share those with you before they shared their general opinion about that. And so again, these are in the slides that we can make available to you. But Aiden and Oliver, if you want to take over at this point, I'm happy to sort of move through these slides for you. But if you want to talk a little bit about the conclusion that or the ideas that came out of this. And I'm not sure if Ayana's been able to join us yet or not.
Aiden, do you want to just trade off?
Oh, yeah, let's do that.
I can start. So some of the pros of a tobacco-free generation ordinance would be healthcare cost savings, because if you're preventing tobacco use, you're going to be benefiting the health of young people. Legal sales will fall. There's a sort of sense of youth protection through prevention. The more you can limit access, the better. And then it could be a start with a limited restriction through the group model. So if you're going to pass a bylaw like this in a local area, it's a way that you can sort of test it out and then see if it's going to be effective at a wider scale.
Aiden, do you want to add anything to this page at all?
I was just going to read some of the statistics that Ayana had that I have in her notes. So she wrote that analysis from the Department of Public Health indicate that restricted menthol sales successfully reduce smoking prevalence with projected 10-year health cost savings close to $200 million. As far as youth protection, proponents argue that restricting flavored products help stop the pipeline of new, younger users from becoming addicted to nicotine. And that's pretty much what I have for that.
Here's our second page of pros.
Here, I can jump in if you want. So this could ideally fade out the use of tobacco. The conversation around it, that's generally usually a positive of something like this, is you're bringing the conversation back into the center. And so it could lead to wider public education. The UK has successfully done this. They just recently passed a ban for anyone who is currently under 18. And we certainly can't rely on the tobacco industry to regulate itself. That's no question. That's not something that they're going to sort of self-restrict. So it is a question of how communities are going to address tobacco use.
Ian, do you want to add anything to this slide?
Not really. I mean, one thing that we did want to note is that the UK ban, while they did already pass it, it has not like gone into effect yet. It won't go into effect until the 1st of next year. And so there's really no information on how that is going to turn out on that large of a scale over a long period of time. So that's definitely something, whether it gets passed or not, to be looking at for in the future to see if we want to continue with the ban or if we want to go a different route.
And something we talked about the other day, just to kind of add in, because Ayana isn't here, when Oliver mentioned on the last slide, this whole concept of like laboratories of democracy, like one of the benefits of our federalist system in America is that we actually can experiment with this on the local level and actually watch for outcomes. And so I think we talked a lot about how it's really important, and we recommend like that they wanted to recommend that we watch this stuff carefully and we check on what's happening in communities so that we're carefully tracking, is this working, what isn't working. And in a place like England, where you have kind of unitary government, that doesn't work as well. But like to take advantage of the laboratories of democracy, that was something that these guys brought up, is to just sort of take advantage of it and watch what's happening in these communities that came in to this meeting tonight, for example, and also in Brookline. Okay, now we just have a couple slides with cons, and I'll let these guys share their feelings about it, and then we'll wrap up our presentation.
So some of the cons that we talked about were, one, impact on local businesses in Easthampton, because we know that there are businesses in Easthampton which rely on nicotine sales for their business to thrive, and banning it to a portion of our community will eventually have a strong impact on these businesses, which might lead people to bring their business elsewhere, or even businesses to move elsewhere outside of Easthampton. We have impact on local taxes because these sales are taxed, and so we are receiving taxes from those sales. Access from another town, even if we ban it here, you could drive 20 minutes to somewhere where you can get it in a different town or a different place. And then out of state purchase, we live very close to Connecticut, so regardless, even if we had like a whole state ban, we live so close to Connecticut that someone could just drive to Connecticut and get the nicotine that they're looking for there. And just really summing up all those points, we won't be able to entirely stop the use of tobacco. People will always find a way to, whether it's going to another town and another state or whatever means, they will find a way to continue to use tobacco.
Thank you for sharing.
Oliver, do you want to add anything to that slide?
No, I think Aiden got that covered. I don't know if there's one more slide.
This next one is our last slide, and then they'll go ahead and share their opinions about this.
So limited access to additional services should go hand in hand. I guess I don't entirely know what that means.
I think this was what Leia was talking about. Go ahead, Oliver.
Yeah, so this is where, like, if we're just going to pass a bylaw where we're sort of like widely banning tobacco for lifelong use, generally for success and anything that's going to involve the cessation of substance use, you're going to also want to provide addiction services. It's generally shown that this sort of more like a softer addiction services, harm reduction approach is more successful in stopping addiction. I think sometimes just an outright ban makes something more of a forbidden fruit for people. So if we want to actually successfully reduce addiction, we should not solely be looking to pass a ban, but we should also be looking to provide resources for people, and especially for young people who are currently addicted to nicotine. Do you want to continue with those?
Yeah, I can. And then going back to like you won't be able to stop people from getting it. Third party or black market sellers are gonna likely increase if you pass a ban, and this can also be more dangerous, as we've seen in a lot of other substances that are sold illegally. There's been a rise in things like fentanyl in these substances, and so there is a risk of nicotine products being spiked with these more dangerous substances that we don't see if we have legal sales. And then is this a gateway to this is a question we have. Is the purpose of this ban to eventually create a full ban on nicotine in Easthampton and further in the communities? And then already have significant limits meant that I don't know what that means.
Oh, I think that's just saying that like we're already fairly restrictive on tobacco in Massachusetts. They're very high taxes, and you're not allowed to sell flavored tobacco products or nicotine products in general. But yeah, there's an element there, I guess.
So do you guys just want to draw some conclusions about kind of where you stand personally after weighing out the pros and cons?
Yeah, totally. If you want to, I can start. I guess I want to start with saying like there is no argument to be made for the use of tobacco. It is unquestionably a harmful substance to consume, and I think prevention is generally beneficial. But I think this bylaw will not prevent future generations from consuming tobacco. They'll just drive 10 or 15 minutes in any direction and buy it elsewhere. And for a number of reasons, a local ban will not just prevent this entirely. It's already an illicit substance for people under 21. And so this does not change that status or make it less accessible than it already is. Frankly, like no young people are going into convenience stores in Easthampton and purchasing nicotine products. So really this shift in status is not going to really reduce use amongst people who are under 21. And the purpose of it seems to be to place Easthampton in a sort of moral high ground, which I understand. It's understandable to want to like prevent tobacco use in the future. It's generally a negative thing to do, but I'm wary of any sort of decision that carries this purpose of moral signaling. Easthampton is not a town that prides itself on anti-substance purity. We're flush with breweries and dispensaries, and we're very friendly to consumption. And I see the purpose of legislation that restricts one's rights to make bad decisions. Like if we're going to pass a law that is aimed at stopping somebody from making a bad decision, the main intent of that should be to prevent the encroachment on the rights of others. Something like public intoxication. It's like that is illegal, not to prevent an individual from becoming intoxicated themselves, but to prevent them from disturbing the rights of others in a public place. And so the purchase and consumption of tobacco is an act that generally only harms oneself, given widespread protections against secondhand smoke. I'm not here to argue for the use of tobacco. It's a poor decision. Anyone will tell you that. But I think people should retain the rights to make their own poor decisions.
Aiden, do you want to share your opinion?
I just really would echo a lot of what Oliver would say. I think that the issue with nicotine is a big cultural issue. And I don't know if this ban would necessarily stop people my age from smoking. As we all know, people my age are already smoking and are already addicted to these products, even though they cannot purchase them or consume them legally. And so I struggle to see how this ban would stop them from smoking if they already are when it's not legal for them to do so.
And I think just in Ayana's absence, I think her argument was a little bit more favorable towards like the laboratories of democracy piece. Like, I think if you guys can concur or not concur that she said this the other day, is just that it was a step in the right direction. And she felt like the reservedness of it, as opposed to an outright ban, was certainly better. And that the goals of it were, important. And so I think if she was able to make it, she would have kind of argued that the limited nature of it actually is a good way to sort of experiment and see how it goes. Would you say, Aiden, that that's fair? That that's what she was talking about?
That would be her argument if she was here to give it. Yes.
Yeah, it was a big part of the discussion we were having is that like, although I personally am aware of the legislation, I think a lot of the sentiment amongst the other mentors was that even if there is not necessarily like a complete effect to it, there's certainly an argument to be made for movement in a direction. And that was kind of the general tone. I feel bad the others aren't here, but my position was not the majority tone, I think.
And we just appreciate you inviting us to come and talk about it and giving us a chance to kind of explore some of the legal pieces here, because it was a really great applied way for us to engage in this discussion.
Thank you. That was excellent.
Yeah, I learned a lot. Thank you so much. If I was grading, I'd give you all an A+, obviously. No, in all seriousness, we really appreciate you taking the time. Steve had brought up at our last meeting that it'd be great to hear from some of the people representing the population that would actually be affected by this. So thank you so much for putting all this time and hard work in. We appreciate it.
Yeah, and I'd just like to recognize the fact that these young people from other communities have come here to speak at this meeting. I think that is also phenomenal, and I was shocked to hear that you guys are from other communities, and it really is just amazing to just see and hear young voices. So thank you for inviting us, and thank you to those young people for coming.
Awesome. Yeah. Thank you so much.
Yeah, I want to thank you guys for coming as well. The first thing I thought of was to have you guys at the meeting, because I know what you do in Easthampton. I know what you guys study. It's important. So thank you for sharing everything and your perspectives as well.
A lot of what we do is far away from local government, so it's really fun when we get a chance to apply the kind of legal work we do to something that actually impacts us directly. So it's very cool.
Thank you again.
If it's okay with the board, can I just ask Aiden Oliver a question?
Of course.
Sure.
What would you guys say is the most common nicotine product you've seen used among high schoolers in Easthampton? Vapes, pouches, cigarettes, in your opinion?
I think vapes. I think that's probably the most common amongst young people.
Yeah, I would agree. There's a lot of vapes, and there also has been a rise of Zens or nicotine pouches. You'll always find those somewhere in the school, for sure.
Thank you, and congratulations again on graduating. And really appreciate you being here tonight.
Thank you very much. Thanks for having us.
All right. Anything else before we move on to our next agenda item?
Nope.
Okay. All right, so the next agenda item is to actually vote on the proposed tobacco regulations. So we've had quite a bit of discussion on this. We've had a lot of public input. I feel very, very well informed. Probably better informed on this than I've been on anything else that I've done on the Board of Health, so which I'm very grateful for. So I guess the first question is, Steve, do you feel ready to vote today? I feel ready to vote, but I want to make sure that you are ready to vote.
My only holdback with this is, I know, Ryan, how often does this have to be reassessed by the health department and checked on? I don't know, it would be a good opportunity to analyze any data we've collected over the years, or if there is an actual impact, if there's any findings with convenience stores or other places, violating such a regulation. I thought maybe a 5-year review would be helpful.
Yeah, I think that's an excellent idea, and definitely can put that in there, that we can review this in 5 years.
I don't know if 5 years works for you too, Beth. All three of us might not be here, but at least give Easthampton something to track over the years.
Mm-hmm.
I mean, yeah, I mean, I don't know if that's data that we already, as a town, as a board, keep track of, but if not, I think for sure, if we're making this kind of a change, we should be a laboratory for democracy and keep diligent records of data, that whatever data we can get.
Yeah, I think that's an excellent idea. We do have records of violations in our tobacco establishments, selling to anyone under 21 or selling at lower prices than what we already require. But I think just reviewing it in 5 years, looking at the surveys that the high school does every 2 years, and just seeing what those reported levels are of tobacco users, I think that would be an excellent idea.
Yeah, and maybe we could even somehow come up with some way to get a sense from our local businesses about anything they've noticed. I mean, my assumption is the impact won't be seen there for years with this. But I'd be curious to know. I would want to see all the data that we can get. So.
Yeah, that's more than doable. My only other request is that if the board chooses to implement this, that we have a 2-month wait on the date that it goes into effect, just for us to educate tobacco establishments on the regulations and allow them to ensure they don't have those products in their establishments.
Well, that was going to be my next question, because I feel like if we're going to vote on this, we should have the specifics laid out. So date, born after, born before date, and when it goes into effect. So I think we had discussed at our last meeting, maybe like January 1st of whatever year being the date that makes the most sense for year of birth. So what was it, January 1st?
January 1st, 2026. So then anyone who is not yet 21 as of January 1st, 2026 wouldn't be able to purchase tobacco products, and who's not 21 as of next January 1st wouldn't be able to purchase tobacco products in Easthampton or nicotine products in Easthampton.
2026 or 2027?
2026, because then it'll be 2027 January 1st.
Okay. So I guess sorry, my brain is tired.
I'm not a math specialist. I hope you're checking it.
I guess I don't want anyone who is 21 currently, and like that's the whole point, right? It's not going to affect anyone who's currently allowed to purchase nicotine products. So if you were born on January 1st, 2026, which is in the past or before, I just want to make sure that.
Do you mind if Ken has his hand up? Do you mind if he addresses the board? He'll help us with the math, I'm sure.
That would be great.
All right, go ahead, Ken. Thank you. Ken, you're muted. Ken, you're muted. We can't hear you.
Ken, you're muted.
Some people would think that was a good idea. So I did not teach in Easthampton High School, but I did teach in West Springfield High School math, as it turned out. And 27 minus 21 is 6. So it would be 2006 for the birth date if you were choosing January 1st, 2027 as your implementation date.
Thank you, Ken. I appreciate that.
Because you'd be 1 year old if you were born in 2026. Thank you.
We're starting it. So we're starting it January 1st, 2027, assuming it passes, and we are the birth date is January 1st, 2006.
Correct. Anyone born that date or past that date.
Okay. Thank you.
So yeah. So no one who is currently legally 21 and able to purchase tobacco products would be affected.
Okay. And the other things that I'm recalling from your previous slides and things was the details, like we're banning all nicotine products. That was the I'm trying to remember, you had broken down.
No, okay. I can go through each one just for reference. So the first one would be no renewal of tobacco establishment's permit if there are 3 sales to anyone under 21 or under the nicotine-free generation age within the previous year. Number 2 would be the nicotine-free generation. Number 3 would be the retiring cap on our tobacco establishments. So anyone who doesn't renew or has their license revoked, that tobacco establishment permit would automatically be retired. Number 4 would just be updating the minimum cigar pricing to be in line with our neighboring communities. Number 5, I believe this is what you're referring to, Chair Rist, is the sale of nicotine pouches would be restricted to adult-only retailers. So that would prevent, gas stations or anywhere like that from selling the nicotine pouches. Those would only be able to be purchased in adult-only 21 plus tobacco establishments. And then number 6 would just be setting our suspension periods in the regulations, which we already go by, which would be the 3-day, the 7-day, and the 30-day. And then number 7 is just updating the permit, the distance tobacco establishments have to be from a school or an existing tobacco retailer from 500 to 1,000 feet.
That was number 7.
That was number 7. That was number 7. Yeah.
Okay, thank you for reviewing that. I think it's good to have everything out in the open before we vote. All right. Anything else, Steve?
I was just going to make a motion to add an expiration date of 5 years to the draft regulation.
An expiration date?
Or we could add
5 years to
a mandatory review date in 5 years. If that,
number 8.
I will. Yeah, if you want to amend your motion.
Ryan, what language did you want to use?
Regulation has to be mandatory reviewed by the board 5 years from date it goes into effect. No more than 5 years from date it goes into effect.
I'll make a motion to amend my previous motion that the health department will review mandatory review of after 5 years of the date of implementation.
I'll second that motion. All in favor, Beth, yes.
Steve, yes.
Okay.
And so the 21 nicotine-free generation, if this was to be voted into effect, would go into effect January 1st. And for the rest of the updates, if this was to go into effect and you were to vote yes, would so it's June now. Would September 10th be reasonable? 2 months from today?
For all of the other pieces.
Correct.
Apart from the nicotine
the whole
free.
thing, but the nicotine-free generation wouldn't start until those born after January 1st, 2006.
Okay.
But I think
Yeah,
2 months would be reasonable for us to just get the updated regulations to all tobacco establishments, then hold an in-person information session.
Sounds good to me.
I'm okay with that.
Okay.
All right. So if you are ready, Steve, we can do this, pass this with a motion, I think.
Sure. I'll make a motion to vote on the proposed tobacco regulations for Easthampton.
Okay, I'll second that motion. All in favor, Beth, yes.
Steve, yes.
And to clarify, we're voting yes to the proposed regulation.
Correct.
Excellent. Thank you. I'll email you that just for your signature. And once you sign it, I'll have it posted and sent to the city clerk.
Sounds good. Thank you so much.
Thank you. And thank you everyone for coming, and especially thank you to Easthampton High School and Aiden and Oliver. I really appreciate it.
Yes, thank you so much, everyone. All right. So next agenda item is Director of Public Health update. And I would just like to just because of the length of the meeting. If I have reviewed everything, so if you want to give us the bullet points or the highlights, that's completely fine with me.
I appreciate it. Thank you. The only highlight I'm going to give is the override did get voted in last night. And the first thing I want to say is I'm very appreciative to all the residents of Easthampton that voted for that. We're going to be able to have a level funded budget for the health department, which means our staff aren't going to get their hours reduced. However, it also means there's still a hiring hold in Easthampton. So it's still going to put a hold on us hiring a nurse and an outreach worker. But again, I just want to really thank the community members of Easthampton that went out and voted. And I'm very thankful this passed for our city, our schools, and our public services.
Yes, thank you. I feel the same way. I echo your sentiment. Anything else you wanted to report?
Nothing.
All right. So then we will move on to the health inspector update.
Hi guys. I'm just gonna quickly touch base on anything we talked about last time for a quick update. Lots of events is on our website if anyone's interested to look at those during the month of June. For Dynasty Gourmet, I checked back in after the new owners. Everything looks good. I did just notice, shout out to Irza. She saw on the reviews that they're now making sushi, which is a risk of 5, and they need a HACCP variance. So working on that with them. So they're not making it right now. Tong Sing went back as well for an update with him after his emergency shutdown. He's good to go, in good shape. I'll be back there in a couple months to double check with him again. Easthampton Diner, they've been having trouble. They've been on our 3-month list. So what I did was I'm having them go through a food training plan with a consultant to train them over a 6-week period to work with them and kind of go over everything, because it seems like there's lots of repeated violations. It's not getting through. So they have hired somebody to go and work with them to follow food safety, and I'll be getting reports over that 6-week period. And then camps are still going, working on those. For housing updates, 531 East Street, no improvement. So what we'll be doing is I'll be going bi-weekly, and then once the fines get to 1,500, we will be adding that to our housing court list. 83 Garfield is condemned. Their water was shut off last week, and our plan is receivership. 166 Holyoke, he's working with Tom and Veterans Services for cleanup, and we're shooting for June or July to pick up that property. It's right off to the left of that hill. Just happening, was it yesterday or 2 days ago? 22 to 24 Exeter. There's a fire. I don't know if you guys heard about that. It's condemned. And then I'm working on another with EPD with 19 Lyman Ave. Just miscellaneous bulky items and multiple vehicles on the property. So those are just the highlighted updates. And if you guys have any questions, let me know.
Thank you, Kelsey.
Yeah, thank you. I read through your report, and I appreciate your hard work.
Yeah, no problem. And I know I have to add it as like I submit it, but then I have to add more as it leads up to the meeting. So that's why I have a little bit extra. But thank you.
No worries.
Yeah, thank you. I know the housing is continuing to be problematic for you guys, but keep doing the right thing, and I feel like we can get them cleaned up, and maybe get some residents in there that'll take care of them, keep them nice, and yeah, thank you.
All right. Number 7, our community health worker update. Brad.
All right, thank you. Just 2 things that I wanted to touch on that have either changed or are brand new from the report that I sent you that was in your packet. So the first is I got an update today from the process for the Wetlands Protection Act for the Remembrance Garden that's being paid for with the opioid abatement funds. It actually looks like all of the criteria for the project meets the Wetlands Protection Act exemptions. So I think we don't actually have to go through a lengthy review process. We may be able to just, get everything set up through the mayor's office. And there's going to be one final check from the Conservation Commission, but this is really just to ensure that everything looks above water. So thankfully, we don't need to go through a whole process. We won't need to advertise and submit all the applications. So that this should be a pretty quick process now going forward. I did originally say that it was going to be lengthy, so that's the one update there. The other thing is sometime last month or so, there was a reported instance of a potential sexual assault that happened in one of our tattoo establishments. And, I'm really thankful for Inspector Leclerc for, handling that process and working with the members of the community. One of the things that has come out of that is a desire to sort of revisit tattoo regulations in Easthampton. So first process that I've done is just kind of looked at all of the constitutional affordances that would be at your disposal. But before I present those to you for potential review, the goal is to meet with the business owners of the tattoo establishments on the 17th of this month and then the 24th of this month. And really the goal is to hear from them, right? What of our regulations still make sense? Are there things that we would potentially propose that might actually be harmful? Or, it's really just an opportunity to hear from the industry what makes sense going forward. And I know they had some thoughts additionally as, some of the regulations that we have are just outdated and, tattoo establishments do things that are sort of above and beyond this anyway. So it might be helpful to just take a crack at what our regulations look like and do a refresh. I think it's probably been 10 plus years or more since that work has been done. So my goal is to meet with them over the next couple of weeks. And then similarly, like I've done with you in the past, I'll sort of send over some resources for your consideration, and then we can, start that conversation if you feel like it's necessary. But just wanted to update you on, this situation that's happened within our community, and that we're trying to find a restorative, community-centered approach towards revisiting regulations. So otherwise, that is all from me. I'm happy to answer any questions that you have.
Thank you for that. I know that we, at least in my time here on the board, we did have at least a partial review of those regulations because we had a request to change some of our guidance around apprentices in the tattoo. Okay. So I think we have definitely recently reviewed them. So I think I think that would be worth revisiting that. And I'd be happy to add that to the agenda for next month, unless you think you may need more time, but we could, invite the people that you talk to from the tattoo parlors to come to that meeting. And so I'd be happy to do that.
Okay. All right. Sounds good. Yeah, I think that's fine. I've got most of the policy analysis work done. But this is just an opportunity for the business owners to take a look at it and to also be able to advocate for themselves. So for sure, at the July meeting, we can make that happen. And I know they've already, at least one of the business owners has expressed interest in wanting to participate in a process like coming before you to talk about these things. So I know there's at least some community buy-in already.
Great. So Irza, maybe we can add that to the agenda for the July meeting. Its own agenda item.
Got it.
Thank you. Anything from you, Steve?
No, I think we should add it as well and see what we can improve or, get some input from the community.
Okay. All right. Thank you.
Thanks,
Thank
Brad.
you. All right. Number 8 is Board of Health Regulation Reviews / discussion. Do we have anything specific?
Brad handled it perfectly. I'm just going to let you know that next month we're going to have some proposed updated tattoo establishment regulations just to protect safety of the clients and how we can better assist in that with some regulations, working with our tattoo establishments in Easthampton, which have been great overall, and just working together to see how we can better protect the residents of Easthampton.
Great. Sounds good. Okay.
How often do you guys visit the tattoo establishments?
Every 6 months. So we do 2 mandatory inspections a year, and all the inspections are excellent. We have no problems with any of our tattoo establishments. They're all, pretty much perfect. No concerns with any of them from an inspectional standpoint.
Okay. That's all. Thank you.
All right. Any items not reasonably anticipated by the chair 48 hours in advance of the board meeting? I have nothing.
Don't have anything to add.
Very good.
Great. So
I think that's it.
All right. I'll make a motion to adjourn at 6:42 p.m. on June 10th.
I'll second that motion. All in favor, Beth, yes?
Steve, yes.
This government meeting is brought to you by Eastworks and our local cable subscribers.